here. You know, I mean, I have some slides, but again, they are labeled, so it's easy for you to spot them and find out how do they look like within the red blood cells. But if you remember, a typical red blood cell is like a donut shaped, right? So there are tons of them. And then if you find a specific discoloration of these sites, and you have to look like hundreds of them before you get that. And then again, as I said earlier, all you need to know is that you have to make a thick and thin smear. You have to know all the 4 types: falciparum, virus, malaria, and ovale, as the treatment is different. These are the gold standards for that. Okay, let's talk about the treatment. Guidelines are available, they keep on changing. The primary focus, again, is that you have to give appropriate medication, which I'm going to discuss in a while, and then supportive care if needed. For example, you know, if the fever is higher, you have to give antibiotics. If the person is having nausea, vomiting, diarrhea, you have to take care of that. If it is happening in a pregnant lady, so things are a little bit different as we approach different type of patients. But the ultimate goal of the malaria therapy is that you have to rapidly diagnose, we have to start medication. But I told you that it takes a while because you need to do that in terms of what we call rapid diagnosis by a specialist, and they are not easily available. And then the idea is that you have to get rid of that infection within 2 to 3 days. And if you fail to do that, then the patient is a very high mortality. So you will have hypoglycemia, pulmonary edema, and renal failure. So this is a very nasty picture, especially in pregnant women, in children, and especially if you're stuck in an area in Amazon, jungles of Brazil, or something like that. There is no treatment available and there's no prophylaxis. So that's a very sad story in terms of treatment options available. Now, there are quite a few treatment options available. And what as a physician or a healthcare profession, you have to make sure that you have to look at all these factors that are there. Like any drug, you have to really firstly find out that which drug is indicated depending upon the age, depending upon the liver status, and then again which has fewer side effects, and then again if there are a lot of organ failure, like pulmonary edema is a respiratory failure, and kidney infection is a renal failure. So if you're dealing with multi-organ failure, it's going to be a tough job for you to look at. And of course, this can also only happen in a intensive care in a big hospital. So unless you're stuck in a place where you can't do anything, you would rather shift the patient to a bigger place. Unfortunately, like other problems, we have resistance patterns. That's another issue that by the time you start practicing, you will see that unless and until we develop new drugs, so we'll have antibiotic resistance, we have antiviral resistance, we have anti-malaria resistance as well. So these are some of the things they are there, and as I said earlier, best bet will be to transfer the patient to the specialist hospital. Now, these are your memory road material, and all I'm interested right now is just for you to remember their names without going into details. And these are at least 6 different type of drugs which are available. And some of the drugs are important because you will see, like for example, chloroquine. So chloroquine has been there for ages. So this was the magic drug people are taking, right? And then it was developed into hydroxychloroquine. And then all other drugs, they're all orals. And then if you remember, when we talked about quinidine, for example, so quinidine has effects on cardiac, so it is an antiarrhythmic drug as well. So you can see the complexity of all of these drugs which are there for malarial treatment. They will have other effects, side effects. So whenever anybody, even in a pharmacology class, we're going to talk about these drugs. So you should be familiar that of all the other effects that these drugs have, like antiarrhythmic and cardiotonic and so on and so forth, they also have a anti-malarial basis as well. So that will give you an idea that if you are going to give this in certain doses, you have to be careful that you're looking at ST elongation and all these kind of cardiac effects which are there. And the general scheme of things that we usually teach our students is that uncomplicated malaria and complicated malaria is called severe malaria. So uncomplicated means oral treatment, right? And complicated severe malaria where you go for IV treatment. So that's like a bigger picture. But if you look at the oral treatment, you can see it starts with chloroquine. But the problem again is that chloroquine was the first drug developed, but the malaria species have becoming, for some reason, resistant to that. So that's the best bet that we use, penicillin, right? And so you basically firstly have to find out, the very first question for oral therapy is that particular type of malaria, is it chloroquine resistance or susceptible? So if it is resistance, then you have these 3 lines of drugs that's given on the top. And if there is susceptible, of course, chloroquine, hydroxychloroquine are there available. And then again, for severe malaria is quinidine. And if you cannot use quinidine because that has a cardiac effect, because it causes arrhythmias, right? And then again, I'm not going to teach you the one on the side, but whosoever is going to teach you about that will tell you exactly what actually goes on in terms of IV treatment and how you balance. But I can just assure you that all these things have to be done in a hospital setup, of course, because you have to monitor the heart of the patient and want to make sure that the treatment is initiated in time. So the basic idea for the treatment is that the species of malaria is to be known. Because you cannot give a generic, it's just like there's no generic drug. So you have to make sure, you have to ask yourself, a physician, whether it is uncomplicated or complicated. For uncomplicated oral, in oral it's going to be chloroquine resistance or chloroquine sensitive. And in IV, it has to be quinidine, and then quinidine has a cardiac effect. So this is what the important thing is. And again, treatment of choice is chloroquine and hydrochloroquine. And then again, you have to add primaquine. Primaquine usually is the one that I used to take for prophylaxis purposes. But it's got a lot of distaste, and you have to start, if I was to travel, like for example, after 3-4 days, I'll start taking 3-4 days ahead of time, and keep on taking afterwards as well. So this is like some of the information that is available. And I'll just stop here. Any questions on malaria? Have you ever seen, I'm not going to ask you have you had malaria or not, but have you ever seen any case of malaria in your family, in the kith and kin? None. I just told you that it's very rare for people coming from Africa and Asia not to have malaria in their lifetime. It's very rare. But the extreme form of malaria is that it can cause meningitis. So that's a very severe form of malaria, meningitis. That's where we have to start the IV treatment. And then also, I usually give my stories there in my YouTube videos as well. That probably when I was a master's student in England, I came for a conference here in the US, and all of a sudden I